Imagine this. You wake up groggy after yet another restless night, reaching for that cup of coffee to jumpstart your day. But what if I told you that those sleepless nights could be doing more than just making you tired? Did you know that poor sleep can increase your risk of kidney disease by up to 60%? Yes, you heard that right, 60%. It's a staggering number, especially when we consider how vital our kidneys are to our overall health. But here's the kicker. Many of us might be sacrificing our kidney health without even realizing it. How often do we brush off a night of poor sleep, thinking it's no big deal? We tell ourselves that we'll catch up on rest later, but what if that later never comes? What if, in our rush to keep up with life, we're unknowingly putting one of our most essential organs at risk? This isn't just about feeling tired or cranky. It's about a hidden danger that could be silently impacting your health. So the question is, are you sacrificing your kidney health without even knowing it? In the next few minutes, we're going to dive deep into how sleep impacts your kidneys and, more importantly, what you can do to protect them. But before we get into that, let's unravel the mystery behind this startling connection between sleep and kidney health, because the answer might surprise you. The kidneys are remarkable organs, working around the clock to filter waste and excess fluids from our blood, ensuring that our body remains in perfect balance. They're like the unsung heroes of our health, quietly doing their job without much fuss until something goes wrong. Every drop of blood in your body passes through your kidneys multiple times a day, being cleansed of toxins and balanced for the right amount of fluid. But what happens when your body doesn't get the rest it needs? You see, sleep isn't just a time for our minds to recharge. It's a critical period for our bodies to perform essential maintenance tasks. One of those tasks is regulating blood pressure. When you sleep, your blood pressure naturally drops, giving your heart and blood vessels a much-needed break. This drop is vital for maintaining healthy kidney function because the kidneys rely on stable blood pressure to filter blood effectively. When sleep is cut short or disrupted, this natural drop doesn't happen, leading to consistently higher blood pressure, which puts extra strain on the kidneys. But that's not all. Poor sleep also leads to an increase in stress hormones, like cortisol, in the body. When these stress hormones rise, inflammation follows, and that's where trouble begins. Inflammation is like a slow-burning fire inside your body, gradually damaging the delicate tissues of your kidneys. Over time, this can lead to scarring and reduced kidney function, a serious consequence that many of us might not even be aware of until it's too late. And then there's the circadian rhythm, your body's internal clock that dictates when you should sleep and wake. Your kidneys are closely tied to this rhythm, with their filtering process being most efficient when your sleep-wake cycle is consistent. Disrupting this cycle by not getting enough sleep or sleeping at irregular times throws off your kidneys' timing, making them less effective at doing their job. So what does this all mean? It means that your kidneys depend on good, consistent sleep as much as any other part of your body, if not more. But how do we ensure our sleep is benefiting our kidneys rather than harming them? That's exactly what we're going to explore next. Stay with me, because understanding this connection could be the key to protecting your kidney health in ways you never imagined. Let's take a moment to consider the real dangers that sleep deprivation poses to our kidneys. We often hear about the importance of sleep for our heart, our brain, even our mood. But what about our kidneys? The truth is, the stakes are high, and the risks are far greater than many realize. Research has shown that consistently getting less than 7 hours of sleep per night can significantly increase your risk of developing chronic kidney disease, CKD. That's right, just a couple of hours less sleep than recommended, over time, can start to take a toll on your kidneys. Chronic kidney disease is a serious long-term condition where the kidneys gradually lose function, leading to waste buildup in the body, and it can eventually progress to kidney failure if not managed. The connection is clear. Less sleep equals more risk. But why does this happen? It all circles back to blood pressure, that vital force that keeps our blood flowing through our veins and our organs functioning properly. When you don't get enough sleep, your body's ability to regulate blood pressure is compromised. This leads to a condition known as hypertension or high blood pressure, which is a known contributor to kidney damage. Over time, the constant strain of high blood pressure can wear down the blood vessels in your kidneys, making it harder for them to filter waste and balance fluids. The result? A slow but steady decline in kidney function that might go unnoticed until it's too late. Now let's talk about sleep apnea, a condition that affects millions of people but is often undiagnosed. Sleep apnea is a sleep disorder where your breathing repeatedly stops and starts throughout the night, disrupting your sleep cycle. But here's the scary part. Obstructive sleep apnea isn't just about poor sleep quality. It's also a significant risk factor for kidney damage. When your breathing stops, even briefly, it reduces the oxygen levels in your blood, putting stress on your heart and, you guessed it, your kidneys. Over time, this constant fluctuation in oxygen levels can lead to increased inflammation and damage to kidney tissues. So if you or someone you know struggles with getting enough sleep or has symptoms of sleep apnea, like loud snoring or feeling tired even after a full night's rest, it's more than just an inconvenience. It could be a silent threat to your kidney health. But what can be done about it? The good news is, there are steps you can take to protect your kidneys and improve your sleep at the same time. Up next, we'll delve into how quality sleep can actually help promote better kidney health and what you can start doing tonight to make a difference. You won't want to miss this. When we talk about the importance of sleep, it's not just about the number of hours we spend with our eyes closed. It's also about the quality of that sleep. This is where deep sleep, the most restorative phase of our sleep cycle, comes into play. During deep sleep, your body shifts into repair mode, working to heal tissues, strengthen the immune system, and crucially, support the kidneys in their critical functions. It's like hitting the reset button for your body every night. In this phase, your kidneys are hard at work filtering waste from your blood with heightened efficiency, minimizing strain on these vital organs. The better and deeper your sleep, the more effective this process becomes, giving your kidneys the break they need to perform at their best. But the benefits of quality sleep don't stop there. Remember how we discussed the role of sleep in regulating blood pressure. During deep sleep, your blood pressure naturally drops, allowing your heart and blood vessels, including those in your kidneys, to relax and recover. This nightly dip in blood pressure is crucial. It not only protects your kidneys from the damaging effects of high blood pressure, but also ensures that they can function properly throughout the day. Without sufficient deep sleep, this protective drop in blood pressure may not occur, leaving your kidneys vulnerable to damage over time. Another critical aspect of kidney health that is closely tied to sleep is the balance of fluids and the removal of waste from your body. When you sleep well, your body maintains a delicate balance of fluids, ensuring that your kidneys can effectively filter and eliminate toxins. Poor sleep, on the other hand, can disrupt this balance, leading to fluid retention and making it harder for your kidneys to do their job. Over time, this imbalance can contribute to kidney strain and potentially lead to more serious issues. So why does this all matter? Because by simply improving the quality of your sleep, you're not just helping yourself feel more rested, you're actively supporting your kidney health. But how can you ensure you're getting the kind of deep, restorative sleep that your kidneys depend on? That's exactly what we'll explore next. We'll dive into practical, easy-to-implement tips that can help you sleep better and, in turn, keep your kidneys functioning at their best. You're just one step away from taking control of your health in a way that could make all the difference. Stay tuned. What's coming next could change the way you think about sleep forever. If you've ever struggled with getting a good night's sleep, you're not alone. But when it comes to protecting your kidney health, quality sleep isn't just a luxury. It's a necessity. Thankfully, there are practical steps you can take to ensure that your sleep is as restorative as possible, giving your kidneys the support they need. Let's explore some tips that can make a real difference. First and foremost, establishing a consistent sleep schedule is one of the simplest yet most powerful ways to improve your sleep quality. Going to bed and waking up at the same time every day, even on weekends, helps to regulate your body's natural circadian rhythm. This internal clock governs your sleep-wake cycle and directly influences how well you sleep. By sticking to a regular schedule, you signal to your body when it's time to wind down and when it's time to wake up, making it easier to fall asleep and stay asleep throughout the night. But it's not just about the timing of your sleep. How you prepare for sleep is equally important. Creating a relaxing bedtime routine can work wonders for helping your body transition from the business of the day to a state of rest. Whether it's reading a book, taking a warm bath, or practicing meditation, engaging in calming activities before bed tells your brain that it's time to relax. This routine acts as a cue, helping you drift off to sleep more easily and ensuring that you reach those deep, restorative stages of sleep that are so crucial for your kidneys. Now let's talk about what to avoid in the evening hours. Stimulants like caffeine and alcohol can be major disruptors of sleep. While that evening cup of coffee or glass of wine might seem harmless, both can interfere with your ability to fall asleep and stay asleep. Caffeine, even when consumed earlier in the day, can linger in your system for hours, keeping you wired when you should be winding down. Alcohol, on the other hand, might make you feel sleepy initially, but it disrupts your sleep cycle later in the night, leading to restless sleep. Limiting these substances in the hours leading up to bedtime can make a significant difference in your sleep quality. Your sleep environment plays a crucial role as well. To truly optimize your sleep, your bedroom should be a sanctuary for rest. Aim to keep it dark, quiet, and cool, conditions that promote the best possible sleep. Consider blackout curtains to block out light, white noise machines to drown out disruptive sounds, and setting your thermostat to a cooler temperature, as our bodies sleep better in a slightly cooler environment. These small adjustments can help create the perfect environment for deep, uninterrupted sleep. Finally, if you're still struggling to get the quality sleep you need, natural sleep aids might be worth considering. Herbal teas like chamomile are known for their calming effects, helping to ease you into sleep without the grogginess that can come from over-the-counter sleep medications. Supplements like melatonin, a hormone that regulates sleep, can also be beneficial, particularly if your sleep schedule has been disrupted. However, it's always a good idea to consult with your healthcare provider before starting any new supplement, especially if you have existing health conditions or are taking other medications. By incorporating these tips into your daily routine, you're not just setting yourself up for a better night's sleep. You're also taking proactive steps to support your kidney health. But what if you're still facing challenges, like sleep disorders or persistent insomnia? In our next segment, we'll tackle those issues head-on, offering solutions that can help even the most troubled sleepers find the rest they need. So don't hit that snooze button just yet. What's coming up might be the key to finally getting the sleep your body and your kidneys crave. Sometimes, despite our best efforts to improve our sleep, we still find ourselves tossing and turning at night or waking up feeling far from rested. If this sounds familiar, it might be time to consider whether a sleep disorder is at play. Sleep disorders, such as insomnia or sleep apnea, are more common than you might think, especially as we age, and they can have a profound impact not just on your overall well-being, but specifically on your kidney health. So, how do you know when it's time to see a doctor? If you're consistently having trouble falling asleep, staying asleep, or waking up too early and unable to get back to sleep, these could be signs of insomnia, a condition that can wreak havoc on your sleep quality and, in turn, your kidney function. Another red flag is feeling excessively tired during the day, even if you think you've gotten enough sleep. This could be a sign of sleep apnea, a serious condition where your breathing repeatedly stops and starts throughout the night, preventing you from reaching the deep stages of sleep your body needs. Sleep apnea, in particular, is something that shouldn't be ignored. It's not just about snoring or feeling tired. It's about the strain it puts on your heart and kidneys. The constant interruptions in breathing lead to fluctuating oxygen levels, which can increase blood pressure and cause inflammation, both of which are detrimental to your kidneys. If you suspect you might have sleep apnea, it's crucial to seek medical advice. A doctor can help diagnose the condition, often through a sleep study, and recommend treatment options. One of the most common treatments for sleep apnea is a continuous positive airway pressure (CPAP) machine. This device helps keep your airways open during sleep by providing a steady stream of air through a mask you wear at night. It might take some getting used to, but many people find that it dramatically improves their sleep quality and overall health, including their kidney function. Other treatments might include lifestyle changes, such as weight loss or dental devices that help keep your airway open. Remember, addressing sleep disorders isn't just about getting more sleep. It's about protecting your kidneys and your overall health. Ignoring the signs of a sleep disorder can lead to long-term damage that's much harder to reverse. So if you're struggling with sleep and suspect something more serious might be at play, don't hesitate to reach out to your healthcare provider. It could be the most important step you take towards safeguarding your health. As we wrap up, let's take a moment to reflect on everything we've covered. From understanding how sleep affects your kidneys to taking actionable steps to improve your sleep, you now have the tools to make a real difference in your health. But the journey doesn't end here. There's always more to learn and new habits to adopt. In our final thoughts, we'll recap the key takeaways and set you on the path to better sleep and better kidney health. You've come this far, so let's finish strong. As we reach the end of our discussion, let's take a moment to reflect on what we've learned. The connection between sleep and kidney health is undeniable. Good, restorative sleep isn't just about feeling refreshed in the morning. It's about giving your kidneys the support they need to keep your body functioning at its best. Whether it's regulating blood pressure, reducing inflammation, or balancing fluids, sleep plays a vital role in maintaining healthy kidneys. So tonight, when you're winding down for bed, remember that prioritizing your sleep isn't just a matter of comfort. It's a crucial step in protecting your long-term health. Your kidneys work hard for you every day, and by ensuring you get the quality rest you need, you're giving them the best chance to keep doing their job effectively. So, prioritize your sleep tonight. Your kidneys will thank you tomorrow. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more tips on maintaining a healthy lifestyle. By sharing this video, you could help someone else take that crucial step towards better health. Thank you for watching, and here's to many nights of peaceful, restorative sleep ahead.